Good morning, everyone. I'm Tilini Abebandara Herath. I would like to thank you for providing me with the opportunity to present our study in this forum. The title of this research project is Effectiveness of Brief Cognitive Behavioral Therapy for Patients with Chronic Pain at Colombo North Teaching Hospital. As you all know, pain is an unpleasant physical and emotional sensation due to actual or potential tissue damage. Acute pain is a symptom of an underlying disease. However, when it becomes chronic, persists for more than 3 months, it becomes a disease by itself. Most acute pains are nociceptive due to some form of tissue damage, whereas most chronic pains are secondarily neuropathic due to the certain reversible and irreversible changes in the nervous system, which are collectively called sensitization. Chronic pain is one of the commonest conditions in worldwide. Approximately 100 million adults in the United States are affected by chronic pain at any given time, with chronic low back pain and headaches are the most common conditions. Further, it has been more recently hypothesized that chronic pains and other non-communicable diseases are closely linked through a pathological process called meta-inflammation. However, the exact prevalence of chronic pain is not known in Sri Lanka. It is believed to be a common condition with the rise of other NCDs in Sri Lanka. Its relevance is even more important. This study focuses on reducing the distress and handicap with brief cognitive behavioral therapy for patients with chronic pain in Sri Lanka. When we say brief cognitive behavioral therapy, because original cognitive behavioral therapy will be amended to make it more suitable for Sri Lankan context. It has been made shorter, briefer, and less homework based. So our main objective was evaluating the effectiveness of brief cognitive behavioral therapy in reducing the distress among Sri Lankan patients with chronic pain. Apart from this main objective, we aim to assess feasibility of brief cognitive behavioral therapy to evaluate effectiveness of brief cognitive behavioral therapy in improving associated functional impairment and depression. This study is a single-blind randomized controlled trial which is conducted among the patients with chronic pain who are treated at multidisciplinary pain clinic at Colombo North Teaching Hospital, Ragama. Consenting adult patients who are complaining of chronic pain lasting more than 3 months were included in the study, and people who are not conversant in Sinhala language or previously received psychotherapy or has a history of psychotic disorder dementia were excluded. We were recruited 70 patients with chronic pain and excluded 10 patients and included 60 patients for this study who met the inclusion criteria. These 60 patients were randomized using block randomization. 30 patients were included in the intervention group and 30 were control group. Randomization was done by using computer random number generator according to 1-to-1 ratio. Participants who was blocked into group of 5 according to age and gender. The participants, treating clinicians or researchers had no influence over randomization or allocation. Group 1 is the control group, and patients assigned to this control group received only standard care. Standard care involves pain medications, brief advice regarding self-care strategies. Group 2 is the experimental group, which were received standard care, and they received 6 CBT individual sessions over 6 weeks. We were used 2 measurements, multidimensional pain inventory used as the primary measurement and Beck depression inventory, and revised Didiac adjustment scale and visual analog scale used as the secondary measurement. Ethical clearance was granted from the Ethics Review Committee of the Faculty of Medicine, University of Kelaniya, Ragama. Further permission was sought from the hospital director at Colombo North Teaching Hospital, Ragama, and from Dr. Nilmini Vijayasuriya to use multidisciplinary pain clinic for data collection. The total MPI score was used as the primary outcome variable. SPSS version 22 was used for the analysis. Descriptive parameters were established for the variables examined using the questionnaire outcomes. Relevant frequency and percentages were calculated for qualitative variables, whereas means within standard deviations were calculated for quantitative variables. The mean difference of MPI and other score changes compared from baseline to end of the treatment between the two groups used to evaluate the effectiveness of the treatment. Though there are relatively Though there are relatively the same mean MPI scores in both intervention and control groups in an initial assessment respectively, the post-assessment indicated that there was a notable improvement of MPI scores in the intervention group. This table also shows that there was significant reduction in BDI and RDAS scores in an intervention group. This graph shows the improvement of the intervention group. The orange color line shows the visual analog score before the treatment, and brown color line shows the after treatment scores. This graph also shows the visual analog scores in the control group. Same as the first graph, orange line shows the baseline scores and the brown line shows the scores after 6 weeks. According to the results, we found the patients who received CBT significantly benefited more than the patients who were in the control group. Therefore, CBT is an effective and easily deliverable treatment for the patients with chronic pain in Sri Lanka. These are our references. Thank you. I'm happy to answer any of the questions you may have, any clarifications you may require. Yes, ma'am.